the escalating crisis in pediatric physiotherapy is leaving a devastating mark on young lives, with teenagers facing lifelong trauma stemming from untreated chronic pain and children as young as 4 enduring excruciating waits of up to 18 months for essential care, according to a deeply concerning report from physiotherapists. This alarming revelation underscores a systemic failure within the National Health Service, NHS, leaving vulnerable children and their families trapped in a cycle of suffering and uncertainty. The report, compiled by the Association of Pediatric Chartered Physiotherapists, APP, a respected professional body within the Chartered Society of Physiotherapy, paints a stark picture of the current state of pediatric physiotherapy services across the United Kingdom. The survey, encompassing responses from 155 specialists dedicated to treating babies, children, and teenagers, exposes the unacceptable delays and geographical inequalities that are plaguing the system. Families are being compelled to undertake arduous journeys exceeding 200 miles in some cases, merely to access the NHS physiotherapy services their children desperately need. The sheer impracticality and financial burden of such travel are. The physical and emotional toll on both children and parents is immeasurable, especially when considering the chronic pain and developmental delays that untreated conditions can exacerbate. This crisis extends beyond the logistical challenges. It touches upon the very essence of timely and equitable healthcare access. The lack of readily available, accessible physiotherapy services forces many families into the difficult position of seeking private care to ensure their children receive the urgent attention they require. The financial ramifications of this are substantial, placing an additional strain on already stretched family budgets and creating a two-tiered system where access to essential care is determined by financial means rather than clinical need. This creates a profound sense of injustice and fuels the growing inequalities within the healthcare system. The consequences of delayed or absent physiotherapy are far-reaching, leaving lasting impacts on the physical and mental well-being of young patients. Untreated chronic pain in teenagers can lead to lifelong disabilities, impacting their ability to participate fully in education, social activities, and independent living. The developmental implications for younger children are equally significant, potentially leading to lasting physical limitations and hindering their ability to reach their full potential. In response to the APP's findings, the Department of Health in Northern Ireland has acknowledged the concerns raised, asserting its commitment to improving timely access to these essential services. However, this statement alone is insufficient. Concrete actions and substantial investment are urgently required to address the root causes of this crisis. This includes increased funding for pediatric physiotherapy services, improved workforce planning to address the critical shortage of qualified professionals, and a strategic approach to ensure equitable distribution of resources across all regions of the UK. Only through decisive action and a genuine commitment to prioritize the health and well-being of young people can the NHS hope to overcome this deeply troubling situation and ensure that every child has the opportunity to thrive, free from the debilitating effects of untreated chronic pain and prolonged delays in receiving the care they deserve. The long-term consequences of inaction are simply too grave to ignore. The time for decisive action is now.